here the generic flow chart or flow chart of this generic dispensing. So prescription drugs, example is antibiotic. It requires prescription by the physician, and when the pharmacist receive, the pharmacist will need to evaluate the prescription. Then if the prescription is correct, so the pharmacist will fill or file prescriptions and inform the buyer or patients of all the products that have the same generic name, the same dosage form, and the corresponding prices. Okay, if the brand name is considered to be at expensive price, so the pharmacist will going to recommend a generic drug which is cheaper compared with the branded one, and dispense the product chosen by the buyer or even the patients. And if the prescription is incorrect, so that belongs to erroneous, so fill the prescription, keep in the RX, and report to the DOH for the violation of prescriptions. And violative or impossible RX, do not dispense, keep the RX, and report the violation to the nearest DOH office. So this is considered to be the basic rule in dispensing generic drug here in the Philippines. So we have dispensing aids and materials. We have triangular tablet counters, capsule counter, pan weighing scales, electronic tablet counters, dispensing spoon, measuring cylinder, spatula, mortar and pestle, and balance. So most of you are familiar with this one in our different pharmacy subjects. Okay, so we go now to triangular tablet counters. So this one made of wood, metal, or plastic, raised edge with two-side tablets are counted, counting number rows of tablets, then pouring them. Okay, especially tablets that are bottled tablet, okay, like ascorbic acid or other vitamins. Okay, and you have to pour them into the container using raised edge and guide. So that is known to be the triangular tablet counters. We have another one, the capsule center, metal tray which consists of 10 rows of grooves. The capsule are poured into the tray using spatula and lined up with the grooves. Each complete now will contain at least complete rows multiplied by 10 gives a number of 10 capsules. Okay, if that capsules are considered to be bottled again. Okay, next we have electronic tablet counters. So machine used when pre-packaging is done. So large scale teaching hospital or both or outpatient departments, they have their electronic tablet counters. So clean may not be identified damaged tablets and expensive for drug retail outlets. So here in the Philippines, there is no available electronic tablet counters. Mostly these are used in the United States. Okay, we have dispensing spoon, okay, measuring cylinder, graduated cylinder, and we have paper use. We have the glassine paper, okay, for paper tubs, okay, preparations of some extemporaneous compounding that required by the physician. So introduction labels. Introduction to labels. So labels means display printed information which is secure affixed to the containers. So labels should provide with all necessary info for appropriate use of medicine. So we have general labeling requirements, cautionary, advisory labels, and special instructions for different types of products. So mostly in dispensing process, especially in the community pharmacy or drugstore, so we are required to put out labels, especially dispensing tablets, dispensing tablets not using their original container. Okay, so priority label information should be number one, accurate, based on the RX or based on the prescriptions, legible, okay, or readable, okay, and intelligible and adequate and relevant. So under Article 14, a regulation of practice of pharmacy, or 10918, label dispense. So Upon every box, bottles, or package of medicines compounded or dispensed by the registered and licensed pharmacist on the prescription, there shall be a place affixed in printed seal or bearing among the others. So you have to you have to put there the name of the patient, generic name of the drug, brand name, if any, expiration date, direction for use, name and address of the pharmacy. So name of the doctor and dispense pharmacy. So there is what we call a general informations regarding the use of labels, especially in the drugstores.